Hello, ladies and gentlemen. My name is Dr. Umar Khan, and I am an internal medicine physician, and I practice out of Pennsylvania. And today we have a very special guest, Dr. Hassan Majeed, and he is a psychiatrist. Nice to have you here, Dr. Majeed.
Thank you for having me. My name is Hassan Majeed. I'm child, adolescent, and addiction psychiatrist. I'm working in Connecticut.
Excellent. So today we will be talking about depression, clinical depression, and ways and means by which we can potentially treat depression irrespective of pills that may be prescribed to you. Dr. Majeed, can you tell us first what is depression?
So let's talk about what is clinical depression. Clinical depression is a diagnosis out of DSM. And what we do is we look at some symptoms of the patients as depression or low mood or crying spells, anhedonia, not wanting to take interest in the things what you enjoy doing in the past, and then change in sleep, appetite, energy, focus, concentration, unable to make decisions, increased guilt, and then moreover with that it sometimes comes with suicidality as well.
Excellent. So depression, basically the word speaks for itself. You don't show interest in your daily activities, you have sleep problems, and correct me if I'm wrong, people even hurt themselves and commit suicide. Is that correct?
Yeah, that's unfortunately the most tragic outcome in a depression could be if somebody commits suicide, or they cut themselves, or they burn themselves, or hurt themselves in many other ways.
That surely is tragic. So now let's go right into how we can potentially treat depression regardless of any pills that your doctor has prescribed.
So thank you, Umar, for saying that. First of all, it's a clinical diagnosis. We will highly recommend you should see your psychiatrist or a primary care physician for diagnosis and the treatment. But today what we will talk about is, other than those things, what you can do at home or with your friends or families or with another therapist sometime, some remedies that can help you to get out of the depression. And we'll talk about both therapies and some food supplement. Where would you like to start?
Well, let's talk about the food supplements first.
Okay, so we go start with omega-3 fish oil. It is really magical. It really helps with major depressive disorder. They are double-blinded RCTs, randomized controlled trials on the addition of omega-3 fatty acid in the treatment of depression. And then there is folinic acid. It's not folic, it's folinic acid. And it has a lot of evidence in the treatment of depression. And then SAM-E is another food supplement that helps with the treatment of depression.
All right, excellent. So we have omega-3 fatty acids, then we have folinic acid and SAM-E. And these are available over the counter?
These are all available over the counter, and you can get it without a prescription.
Now, what are certain therapies that you're going to talk about?
Mindfulness-based therapies, so yoga and other mindfulness, being aware of yourself, your body, and everything you're eating and doing and moving, everything is the mindfulness-based therapies have a lot of evidence in the treatment of major depressive disorder. And then the word is cognitive behavioral therapy. So the cognitive therapy, restructuring your thought, the way you think, the way you interpret things, and the way you set up goals for yourself. Cognitive therapy really helps. And the behavioral therapy, which comes with exercise or things you like to do, and be physically active about certain things, it helps with your depression as well. So it's really a mind-body connection. The depression is mostly in the brain, and the neurochemical imbalances, then your body is active, so it counteracts that, and then you become.
Excellent. I liked how you said that depression is in the brain. It's not in your thoughts, it's neurochemical imbalances that are actually causing this. So depression is a clinical disease, just like any other ailment such as heart disease or diabetes. Is that correct?
Totally. And before we leave, I will give you a small tip. If you're smiling, if you have a wide grin smile, you cannot feel depressed. The brain cannot process those two emotions together. So I'm not talking about clinical depression now, but if you're having a bad mood, if somebody really was mean to you, if you put a fake smile on your face like this, you cannot feel sad.
That is a very important tip, and thank you for telling me, because I need that. All right, excellent.
So do I.
Thank you so much, Dr. Majeed. It was a pleasure having you here. And guys, do let us know in the comments below if you have any questions and concerns. And I hope this video helped you out a little bit. But always seek the assistance of your physician first and get yourself checked out. I think that is essential.
Extremely important, because sometimes the symptom of major depressive disorder could be something else, like a thyroid illness or something else. We will talk about it in a later video.
Do let us know in the comments below, and we will surely get back to you. Thank you for watching. Bye-bye.
Studies indicate that a majority of medical emergencies happen due to a failure to take medications properly and on time. Now that is a problem. Lisa is fully aware of this. She downloads the free iMed Tracker mobile app, selects English as her language, clicks on the plus sign, and gets her list ready in no time. Keeps track of her daily schedule, gets reminders, and never misses a dose. And instantly shares her list when she goes to her doctor. Stay healthy, stay safe. iMed Tracker.